The cornea of the eye, though it is similar to the skin in epithelial renewal, it differs in having an avascular, highly organized stroma, and renewal of this surface is handled by limbal stem cells, which regenerate the epithelium without leaving the scar if the stroma remains uninjured. However, if there is chemical infection, surgical or traumatic injury uh, that is deep, it causes disruption of the collagen alignment, leading to scarring and visual impairment. See, this corneal implantation is often successful due to its immune privilege from being avascular. Trachoma is caused by Chlamydia trachomatis, leading to chronic inflammation, corneal scarring, and blindness, making it a major global cause of preventable blindness. Thank you for watching this video. If you have any query, please write in the comment box.